Hello everyone, it's Ravi from the Royal Pharmaceutical Society, and today I'm back with one of my daily updates for pharmacy in relation to the COVID-19 pandemic. Before I give my daily update today, I just thought it would be useful to share some of my own personal reflections of my volunteering activity in a local community pharmacy near to where I live over this weekend. I did exactly the same last weekend as well, and I just thought it would be good to share some of the comparisons to what it was then. Again, this weekend was extremely busy. We had queues going around the corner both Saturday and Sunday, and the intensity of the workload was even greater than what it was last week. It felt like it tripled in some instances as well. Despite this, the pharmacists and the support teams were doing an incredible job. They were going once again above and beyond the call of duty to try and support members of the public, and it was phenomenal to see the level of dedication and commitment. Not just over this weekend, I see it every single day from many pharmacists I engage with and talk to about the sheer level of commitment, and it's phenomenal to see. But it also made me reflect that pharmacists, regardless of whether you're working in community pharmacy, general practice, hospital as well, are doing this day in, day out at the same level of intensity. And I can imagine how draining that is on our workforce. And there's desperate need to ensure that pharmacists and their support teams are well supported during this fight against COVID-19. People are able to get good rest breaks in place. They're well supported. They don't suffer from poor mental health and well-being. And, I often say this, particularly before the weekend updates, it's really important that people try and get some downtime, try and get some rest, try to recuperate as best as possible in order for them to continue delivering the fantastic care that they are. Luckily, over the weekend, we didn't get any sort of rudeness or aggressive behaviour within the pharmacy I was working in. Every member of the public came in was really polite, sensible, adhered to the rules within the pharmacy, particularly around social distancing. They understood we were really busy and they might have to wait a bit longer for their prescriptions or medicine advice or healthcare advice as well, without any much of a fuss. Unfortunately, there have been some instances this weekend in particular where people have raised to my awareness that there has been aggressive and abusive behaviour taking place along a number of different pharmacy settings, and that's extremely upsetting and disappointing to see. And I mentioned this last week as well. There has to be a zero tolerance approach to any negative, abusive and violent behaviour in any pharmacy settings to any type of human, particularly our pharmacists and our pharmacy support teams who are doing a fantastic job on the front line to deliver the best form of care they can to the public. And I would strongly urge any pharmacists or their support teams to call this out, report it. It's just completely unacceptable and you shouldn't have to tolerate that whatsoever. Some of the key updates for me that I thought would be useful for me to give you sort of just updates on. Firstly, we had news yesterday where the governments have confirmed that COVID-19 testing will be available for frontline pharmacy teams. We're currently seeking further clarification of what that looks like, the timescales around it, how it will be implemented. But it's really important to ensure that pharmacists across the entirety of the NHS are able to get access to COVID-19 testing where appropriate. That goes from community pharmacy, general practice pharmacy and hospital pharmacy teams as well. On Friday, we put out a call for greater access to PPE in particular to help protect our frontline teams and staff, but also the public from COVID-19 as well. It's really important that your protection is one of our key priority areas and our number one policy ask at the current moment in time. And while we appreciate PPE is also incredibly important and vital and crucial to have, we also know there are a number of other aspects that are really important to adhere to help prevent the transmission of COVID-19. In particularly social distancing measures across a number of pharmacy settings need to be implemented alongside the use of PPE where needed and where appropriate. Social distancing, as we know, is one of the most effective ways of protecting you, your teams and the public from COVID-19. And I know this is really tricky, particularly within very small pharmacy settings in particular, but it's a requirement that does help prevent this transmission. And it will be really important for pharmacists, pharmacy professionals, owners, employers, chief pharmacy superintendents, you name it, to have a think about how do they adjust their model of delivery to help implement these social distancing requirements alongside the appropriate and needed use of PPE to help protect our teams in particular. Thirdly, we've heard from Asda Supermarket today, and they have confirmed that all pharmacists and their frontline staff will be able to gain access to protected NHS Priority Hours for shopping, provided they show the RPS Supermarket's letter. This letter is available on the Royal Pharmaceutical Society's website on our hub page. Do check out. You can download it. You just need to stamp your workplace stamp on it, and you'll be able to use that for you and your support teams. If there are any other problems in relation to any other supermarkets preventing you from accessing it, can you please get in touch with the RPS straight away? We're going to try and help you sort some of those issues out if you do experience them. Yesterday evening, we heard from Boris Johnson, the Prime Minister, talking about the support, once again showing firstly recognition for pharmacists and their support team on the front line, but also praising the great work that you guys are all doing on the front line, going beyond just helping around medicines, but providing really crucial healthcare advice to the public and helping us battle the COVID-19 pandemic. Lastly, we've also been in the news, in particular over this weekend. So we've had English Pharmacy Board member Ash Soni be on BBC London yesterday, and Sandra Gidley, our president, on Sky News over the weekend, both talking about the fantastic work that pharmacists and our frontline teams are doing day in, day out against the fight around COVID-19 pandemic, but also talking about some of the pressures that you guys are experiencing and the need for the public to support pharmacy, but also the government and the NHS to back pharmacy during this fight against COVID-19. We've had some updates on the website that will be taking place today and tomorrow that I thought I would update you on. We've got a brand new COVID-19 education page at the moment, which has lots of continual professional development resources on it and new educational material that will be being put on today and tomorrow. Our joint RPS and UKCPA critical care webinar has just been uploaded as well for everyone to be able to access. I personally tuned into it. It was fantastic, and I learned in considerable amounts stuff on sedation, stuff on acute kidney injury, and I would highly recommend that people do access it, have a listen of it. It was really, really great CPD, but particularly if you're looking at how do you think about how you could support in the coming weeks around management of COVID-19 and thinking about volunteering work into different sectors and changing your sort of job roles to try and help with to fit in with the clinical care delivery. This could be a really useful educational material to sort of get up to date on. We've got some brand new podcasts that have been put onto the RPS website. In particular, I thought I'd highlight our chief scientist, Gino, has done a podcast on the threat of coronavirus, key issues considering the fake information that's around different types of medicines, being able to help treat it, but also exploring some of the potential and future developments of treatments and a potentially new vaccine. Fourthly, we've added a new section on ethical dilemmas for pharmacy teams in relation to managing COVID-19. And we're also going to be publishing some useful public awareness resources over the next coming day or two to help support you with some of your conversations that you're having with members of the public on the front line. Once again, I just wanted to thank everyone for their continual hard efforts on the front line. The work you're doing is phenomenal, fantastic. And it is a true showcase of how well pharmacy can respond to not just a UK crisis, but definitely a global crisis. And we're all extremely proud of everyone for their extremely great efforts. I'll be back again tomorrow with one of my updates. Once again, if you have any suggestions on any things that we can do to help support you, from guidance, educational material, any issues you would like us to raise with government and the NHS, do get in touch with us through our RPS support line. Once again, thank you for everything. I'll be back again tomorrow. Cheers.